Reverend Dr. Barber, you and other African-American pastors are meeting this week to discuss how some of these inequalities can be fixed. Are you looking at this from the perspective of the coronavirus emergency, or generally speaking, how health inequality can be fixed? Because we could be talking about coronavirus, we could be talking about heart disease, we could be talking about diabetes, we could be talking about a lot of things that affect people of color in this country differently than they affect the general population.
Well, we as pastors are going to have a press conference and make some demands, because you could talk about what's happening right now. You could talk about what's been happening. And one of the great failures of what the Surgeon General said was when he tried to suggest some things about personal responsibility and would take no responsibility for the systemic realities that are happening, many of which the Trump and Pence administration and Republicans and others have helped perpetuate. You see, the issue is not race. It's the immoral legacy and a reality of systematic racism that's causing so many African Americans to die disproportionately. The United States has all of these open wounds rooted in decades of racist policies and the criminalization of poverty. And the coronavirus is revealing that. You know, think about it. Every southern state where you've had racist voter suppression, those who get in office because of racist voter suppression have denied just basic Medicaid expansion. They've denied it to millions of people, and that disproportionately affects African Americans. And we know from studies from the Institute of Medicine that African Americans have less access to affordable, high-quality health care and often receive lower quality care than their white counterparts. Those are realities.